Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Mitch Rodriguez. He's a board-certified neonatologist, but also serves as the Business Development Director for the Beverly Knight Olson Children's Hospital. And today we're going to talk about some of our growth and opportunities here in Central Georgia and throughout Georgia. Dr. Rodriguez, thanks so much for being with me.
Well, thank you for the invitation. Appreciate you having me.
What are some of the goals that Beverly Knight Olson has when it comes to helping other regions develop their service lines?
So our goal primarily is to serve the children of Central and South Georgia, and to do so we basically want to expand our service line, our service area, so that we could provide that service not only in Central Georgia but in South Georgia also. And in doing so, our goal is to expand the number of subspecialists that we have here locally, and then at that point also provide some of these subspecialty clinics in remote areas so that patients don't have to travel here on a regular basis for routine care.
And when it comes to doing some of that expansion, what are some of the early wins that you've seen using specialists in other communities?
So our biggest win to date would be the fact that we've made a relationship with Phoebe Health Systems. That was started in January of this year, although our relationships actually started years before that. But during the COVID epidemic, we basically noticed a couple of things. Number one is that our patients really didn't want to travel too far. And number two, that we already had a relationship established in which we were able to basically take advantage of that to serve our patients during this epidemic.
What were some of the specialists that Phoebe was interested in connecting with here in Macon?
So when you look at pediatrics as specialists, you have to have a certain number of pediatric lives to be able to provide the support to have these specialists come in. So one of the advantages of partnering with Phoebe is that we basically get to combine both our pediatric lives 0 to 17 years of age, and that gives us a larger catchment area, so to speak. But what the initial pediatrics as specialty service that we started, there was pediatric surgery. We started that actually in 2019. And with that specialty, what we are able to see is that patients were able to go in, get their pre-op visits. Afterwards, if they needed to have surgery done, they would come to Macon, have the surgery done here. Afterwards, on the post-op visits, they could once again get it done in Phoebe Putney. And we typically have about 25 patients a month scheduled in that clinic, with about an 85% show rate, and about 50% of those patients end up requiring surgical intervention. Just recently, and part of what we do, we have a governance committee in which we meet monthly with the administration from Phoebe Putney so we could address any concerns, any issues, and make sure that we're staying on track with what we're trying to do for our patients in that respect. And we had an opportunity to share on what we call Connect to Purpose, a little group of patient vignettes that we show so that we could see and we know, it kind of grounds us, lets us know what we're doing and why we're doing it. And what we took was two patients that were seeing our pediatric surgeons in that market. One was a 6-year-old that had an abdominal mass. That patient was able to get all this pre-op work done at the Phoebe Health System, came up here for surgery, ended up having a benign tumor, it was a lipoma, and then went back for post-op care. Another one was a child with an umbilical hernia. This is a 2-year-old, and the parents are just ecstatic about the idea of essentially being able to meet the surgeon at home, closer to home, not having to travel far, come up here for the surgery, and then go back for the follow-up in that respect. And it basically highlighted what we were trying to do in a nutshell, basically trying to get the care closer to home and provide that service.
What are some of the other opportunities you think there are with the Phoebe relationship outside of pediatric surgery?
So what we've, within the clinics, we've also established a pediatric endocrinology clinic, a pediatric hematology oncology clinic, and we're close to getting our pediatric neurology clinic up and going in the next couple of months. Another aspect of what we've done is essentially we have established a pediatric telehealth system to help the pediatric hospitalists at Phoebe Putney address those patients that are inpatient with our pediatric intensivists here. So if they have a patient that's somewhat complicated, that does not need to be transferred here, but does have some conditions that they're not comfortable with, they can consult our pediatric intensivist, and we could do a telehealth consult and basically allow for that patient exchange to occur.
So when it comes to telehealth, so as a segue, we also have some other telehealth and virtual health options that we are we're gladly will experience with our connection connection from Atrium in Charlotte. So what are some of those?
Sure. So as I mentioned before, when you look at pediatric populations, to bring subspecialists into the area, you have to have a certain number of patients available to basically support that service. And knowing that and knowing where we want to be in the next few years, we basically start looking at opportunities in which we could basically take advantage of our relationship with Levine Children's Hospital in Charlotte. And one of those, actually two of those, but the first one we started in January of this year was pediatric infectious disease. And that with the pediatric infectious disease, prior to having this available, what would have occurred if we had a patient in-house that had a complicated infectious disease process, we would have been limited to doing one or two options. Number one, calling a friend, so to speak, and a consultant, and just kind of going over the case by phone, or number two, transferring that child up to Atlanta or wherever for that child to continue care. With our telehealth system in place now with pediatric infectious disease, we're able to essentially, those physicians that are part of this program are able to access the medical record once a consultation request is made. They're able to access all the healthcare issues that so they can review the patient's history. We then schedule a telehealth visit, and the parents sometimes are in the rooms with the child, and they are able to then exchange. The infectious disease doctor from Charlotte is able to see the patient, go over the questions, ask the questions that they need. The parents are able to participate in this process, and ultimately we end up with a situation in which we get the answers that we need without that patient having to leave our hospital. It provides for better care, it provides for less transportation needs, outpatient, and it also provides for better satisfaction by the parents, because once again, they're able to participate in this consultation. It's just like having a face-to-face encounter.
Now, are the infectious disease physicians in Charlotte designed to look for those virtual interfaces, or are they also running clinics and practices in Charlotte?
They have 4 pediatric infectious disease, and what they do is essentially they have a rotation, and one of their infectious disease doctors, typically it's the outpatient for individual, is essentially scheduled to manage all our pediatric consultations.
I see.
So we put a consultation order in, we make a phone call, and within a period of 4 to 6 hours, we are able to get that consultation done. Sometimes sooner if it's emergency, but otherwise if it's just a call, we could take it up to 6 hours.
And they're doing inpatient and outpatient consultations on infectious disease?
Typically we're doing inpatients at this point in time, but at some point in time we may expand that to outpatient, but at this point it is only inpatient.
And you mentioned that was one of 2.
That is correct.
There a second?
The second one is one that's basically, as we've seen over the years, an impact that we've seen in our pediatric emergency department, and that's psychiatric issues. We are unfortunately seeing a problem across the nation of an increased need for psychiatric care of pediatric patients. And unfortunately, we're also seeing that there are not enough providers across the nation to provide this service. And that's not a matter of volume, it's just a matter of number of providers that are available. So once again, taking advantage of our relationship with the Levine Children's Hospital, in April of this year, we established a telepsych consultation. Now that one is both for the pediatric emergency room department and inpatient services, both in the pediatric floor and in the pediatric intensive care unit.
And same kind of interface, parents participate, they receive the consult notes, they do a review, and then they consult with the
That's correct.
parents.
They are able to review the net records, they're able to then help us not only with the consultation, but at sometimes also with disposition, and understanding what needs to happen and how we need to proceed. And it's been very helpful for our pediatric emergency room, and I believe very helpful also for our patients, because otherwise there was a period of time waiting to have disposition made, and that obviously delayed the care that these patients required.
What's the transition of care once you receive a disposition or the diagnosis? What's the transition of care? Back to the pediatrician or the hospitalist, maybe?
So it all depends. It really depends on, number one, if it's just someone that needs to come in and have a diagnosis made and they do not require any further inpatient help, then that's basically, it returns back to the physician. If it's a situation in which inpatient psychiatric care is required, then they help us with basically placement of that individual in that respect.
I see. So they help the transition.
They help the transition and help us sometimes make that decision to help facilitate that process.
Well, switching gears to a different piece, one of the exciting things we had in the media was the founding of a milk depot at the Beverly Knight Olson Children's Hospital. And I wanted to let you give an opportunity to talk a little bit about that,
Sure.
its origins and how it benefits patients.
Fantastic. So clearly I'm a neonatologist, so as a clinician, that's where most of my work is done. A little bit of a historical perspective. In 2015, we decided in the neonatal intensive care unit that to better serve our patient population of very low birth weight babies, and these are babies that weigh less than 3.3 pounds at birth, it was important for us to find a way to provide them all with breast milk. Because we're not sure if the breast milk is as helpful as we think it is, which we believe it is, or if the fact that the formula may be damaging. So in 2015, we started a donor breast milk program, which basically provided for all our newborn babies that were very low birth weight to get breast milk. And the idea here is not to take away from mama's breast milk, because we prefer to have mother's maternal breast milk being used. But a couple of things can occur in our population. Number one, we are a regional center. We cover 28 counties, so there may be distances from which parents have some difficulty reaching us in that respect in a timely manner. Number two, there may be medical conditions or contraindications to using mother's breast milk. Sometimes there's just basically an issue related to the fact that it may take mother 3 to 4 days before letdown occurs, the production of breast milk. And we want to basically start feeding at a really early stage, because that's what the literature tells us it's better for these children. So we use it sometimes as a bridge. With that being said, we started this program in 2015. Since then, I would almost tell you about 99% of our babies that are less than 1,500 grams have been able to get donor breast milk. With that being said, we've seen some dramatic reductions in some of the morbidities associated with these patients related to the potential use of formula, which has been fantastic, because you reduce morbidity and mortality in this patient population, and long-term neuromorbidity also. During this period of time in 2019, some of our members of our communities came to us and said, you know, you guys are using donor breast milk. We think that we should be able to provide some support to these donor breast milk programs. By the way, we use Keens and Daughters out of Virginia. So they asked us to consider us becoming a milk depot center. And by that, what we mean is that if you're a breastfeeding mother and you have excess milk, then you basically, and you pass a series of screening tools and blood work, then you are able to become a donor. And that milk is then basically brought to our depot center. And when we transfer that milk for the families up to Virginia, they process it in that respect. We started this, I want to say it was in February of this year. Since then, we've actually been able, through the community outreach, we've been able to send 4,000 ounces, or greater than 4,000 ounces, of donor breast milk up to Virginia for them to process. And it's not, in this process, by the way, we don't get a better deal, we don't get any preferential service. We're just doing what our community wanted us to do, which is essentially make sure that that cycle of donor breast milk continues to be very, very vivid in that respect.
So once the milk is sent to Virginia and King's Daughters does the processing, is that milk sent back, or how does Macon continue to get its supply? I know we have a surplus that we're sending as well.
So we continue to just basically call in and request our donor. By the way, an ounce of breast milk is about $4 an ounce. Just about the price of a gallon of gasoline now.
Right.
But what we basically continue to use the same services as before.
I see.
Being a breast milk depot, all we are doing is ensuring that we have an adequate supply of breast milk across the nation for all babies that require it in that respect.
So Beverly Knight Olson is really looking at the continuum. I mean, we have it from the neonatal side, we have it from the consult as children get older from any age up until 2 to 18. Anything else you see on the horizon for Beverly Knight Olson that might be in the next year or 2 years? Yeah,
I think one of the biggest things that we're going to continue working, obviously, with our relationship with Levine Children's Hospital and also with Brenner's Children's Hospital at Wake Forest. We'll continue to basically take advantage of what those resources are, and our goal is to continue to expand the pediatric subspecialty services here locally, add to the depth and the breadth of services that we have so we could better serve our patient population.
Well, thanks so much for being with us today.
Well, you're quite welcome. I appreciate the time.
Thank you. And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about the Beverly Knight Olson Children's Hospital and Dr. Rodriguez, please visit us at atriumhealthnavicent.org.